brain doctor exposes hidden stroke risk in common vitamin. 99% of older adults have no idea what truly triggers a stroke, and the answer is far more surprising than anyone expects. Most people over 65 believe vitamins are always good, a symbol of health and protection. But recent scientific evidence has revealed a hidden danger inside those familiar bottles on the kitchen shelf. Vitamin overload, too much of what was once considered harmless, can quietly alter blood chemistry, damage vessel walls, and raise the risk of stroke within hours. Studies from Harvard University and the British Medical Journal have confirmed that certain synthetic vitamins, when taken in high doses, can increase the risk of brain bleeding by more than 20%. It is not junk food or genetics that often causes sudden strokes in older adults, but the silent buildup of excess vitamins. In today's video, we are going to expose the truth about 8 common vitamins that could endanger your brain and your life without warning. Before we begin, leave a comment below to let us know where you are watching from, and stay with us until the end, because some of these vitamins might already be sitting on your medicine shelf right now. Now, let's uncover the first vitamin on the list. Number 1, vitamin E. Every 10 minutes in the United States, an older adult suffers a stroke. That statistic alone is frightening. But what makes it even more unsettling is that the cause isn't always high blood pressure, smoking, or cholesterol. Sometimes the danger hides inside the very bottle meant to protect the heart. One of the most trusted supplements among older Americans, vitamin E, can quietly raise the risk of brain bleeding when taken in its synthetic form or at excessively high doses. Vitamin E was once considered the miracle antioxidant. Advertisements in the 1,980 seconds and 1,990 seconds celebrated it as the nutrient that could slow aging, protect the heart, and keep the skin radiant. For decades, millions of Americans took it faithfully, believing more was always better. But the body is a delicate chemistry lab, and balance, not abundance, is its greatest safeguard. When vitamin E comes from nature, in foods like almonds, sunflower seeds, or spinach, it travels with a team of related compounds known as mixed tocopherols and tocotrienols. Together, they protect the brain's vessels from inflammation and oxidative stress. Synthetic vitamin E, labeled as DL-alpha tocopherol on supplement bottles, is a different story. It is man-made, designed in laboratories to mimic the natural structure, yet it behaves differently inside the body. Research from the British Medical Journal found that synthetic vitamin E at high doses increased the risk of hemorrhagic stroke by 22%. Other studies from Harvard and the National Institutes of Health have echoed this concern, showing that the synthetic version can interfere with the absorption of gamma-tocopherol, the very form that protects blood vessels from damage. In simple terms, it replaces the natural guards of your arteries with weaker substitutes. The science makes sense when imagined in everyday language. Think of the bloodstream as a quiet river that must flow smoothly to feed the brain. Natural vitamin E keeps that river clear, removing debris and preventing small clots. Synthetic vitamin E, however, can make the river run too thin. For someone already taking aspirin or warfarin, this combination can turn the river from gentle flow to flood, leading to tiny brain bleeds that may go unnoticed until dizziness, blurry vision, or confusion appear. A woman named Margaret, a retired librarian from Oregon, who came to see me after fainting while gardening. Her blood pressure was normal, her scans clear, except for a few microbleeds, tiny leaks in the brain's vessels. She had been taking a multivitamin labeled extra strength vitamin E for heart health, which contained DL-alpha tocopherol. When she stopped and shifted to natural food sources, adding a handful of nuts and half an avocado to her breakfast, her symptoms faded within weeks. I always thought supplements were safer than food, she told me. Now I know food is the smartest supplement. That story repeats itself across America. The mistake isn't malice, it's misunderstanding. Many people assume that if a vitamin helps, a higher dose must help more. Yet after age 60, the body's metabolism slows, the liver filters more gently, and the walls of the blood vessels become more fragile. The same amount that once nourished can now overwhelm. Here is the way forward. Read every label carefully. If the ingredient list says DL-alpha tocopherol, pause and discuss it with a physician. Ask whether switching to D-alpha tocopherol with mixed tocopherols or relying on food sources might be safer. Keep daily supplemental doses under 150 international units unless specifically prescribed. And remember, supplements should support the body, not replace its natural intelligence. Aging is not about adding more. It is about learning what truly serves the body that has carried you this far. Vitamin E, in its natural form, remains a friend to the heart and brain. But like all friendships, it requires honesty and respect. When approached with awareness and moderation, it strengthens life. When taken blindly, it can quietly harm. So take the time to understand your body, read your labels, and above all, consult your doctor. Knowledge, not fear, is the real antioxidant. Number 2, vitamin A. In the soft evening light of the American Midwest, many homes share the same comforting routine. After dinner, the pill organizer comes out rows of neatly sorted supplements meant to guard against time. Among them, one bright orange capsule stands out. Vitamin A, long hailed as the nutrient for clear vision and strong immunity. Yet behind its friendly glow lies a quiet risk few ever hear about. Vitamin A is essential, but like sunlight, too much of it can burn. The body stores it in the liver, waiting to release what is needed. The problem begins when synthetic forms such as retinol palmitate or retinol acetate are taken daily, sometimes from several different products at once. Multivitamins, vision boosters, fortified cereals, or cod liver oil. Over months, these small doses accumulate. Once the liver storage tank is full, the excess has nowhere to go. It seeps into the bloodstream, irritating delicate blood vessels and raising pressure inside the skull. That pressure presses on the brain from within, leading to headaches, dizziness, or blurred vision, often mistaken for aging eyes. Researchers at the National Institutes of Health have warned for years that older adults metabolize vitamin A more slowly. A 2014 study published in Stroke found that individuals with elevated retinol levels had a significantly higher risk of ischemic stroke. In simple terms, too much preformed vitamin A can tighten the brain's microvessels, limiting blood flow much like a garden hose bent in half. The danger grows quietly, often showing no signs until the damage has begun. Consider the story of an artist from Santa Fe who painted desert landscapes under the blazing sun. She began taking high-dose vitamin A for her eyes, hoping to keep her vision sharp. After several months, she felt constant headaches and a pressure behind her eyes, yet her vision tests remained normal. When lab results revealed high liver vitamin A levels, her doctor advised stopping supplements. Within weeks, the pain vanished. Her eyesight was as clear as before, restored not by more vitamins, but by balance. Nature never intended the body to absorb vitamin A in fixed amounts each day. Instead, it designed a wiser system. Plants offer beta-carotene, a precursor found in carrots, sweet potatoes, spinach, and butternut squash. The body converts only what it needs, leaving the rest harmless. It is a self-regulating process, a dialogue between body and nature. Nourishment is not a contest of quantity, but of harmony. When the diet includes a rainbow of colorful vegetables, the eyes and brain receive protection in perfect proportion. Supplements have their place, but must be chosen with care. Labels listing retinol palmitate or retinol acetate deserve a second look. Before adding or continuing them, consultation with a physician is essential, especially for anyone who already enjoys fortified foods or cod liver oil. There is wisdom in restraint. A bowl of homemade soup rich in carrots and pumpkin, a handful of spinach sautéed in olive oil, and a walk in morning light do more for long-term vision and brain health than any synthetic capsule. The lesson of vitamin A is the lesson of aging itself. When the body whispers, it asks not for excess, but for gentleness. Number 3, vitamin B6. In the quiet corners of every pharmacy across America, shelves glimmer with promises of sharper minds and stronger nerves. One small bottle often stands out, labeled with hopeful words like brain support or nerve protection. Inside are bright yellow tablets of vitamin B6, a nutrient celebrated for decades as a tonic for memory, mood, and metabolism. Yet beneath that glow, an unseen paradox waits. The very vitamin meant to strengthen the nervous system can, in high doses, begin to harm it. Vitamin B6, known to scientists as pyridoxine, plays a crucial role in the brain's chemistry. It helps produce serotonin, the chemical that keeps mood balanced, and dopamine, which supports focus and motivation. In the right amount, it is indispensable, but the body's tolerance has a limit. When supplements exceed about 100 milligrams a day, especially over months or years, the vitamin turns from helper to saboteur. Instead of supporting nerve function, it can injure the tiny fibers that carry sensation through the limbs. The first signs are subtle: tingling in the feet, numbness in the fingers, or a strange sense of imbalance when walking. Many dismiss it as arthritis or just getting older, not realizing their multivitamin or energy drink may be the cause. A major study, published in Clinical Nutrition, followed more than 5,000 adults over 60 and found that those consuming high-dose B6 were almost twice as likely to develop sensory neuropathy, a painful form of nerve damage. Another report from the Journal of Stroke revealed that long-term excess B6 could paradoxically raise homocysteine levels, a compound linked to arterial inflammation and stroke. These findings surprised many doctors because B6 was once thought to lower homocysteine. The truth, as it turns out, depends on balance with its partners, folate and B12. Without that harmony, the body's chemistry shifts in unpredictable ways. In a clinic on the outskirts of Boston, an accountant in his 70s once came seeking answers for trembling hands. His tests ruled out Parkinson's and thyroid disease. Only after reviewing his supplements did the pattern emerge. 3 different products, each loaded with B6. His total intake exceeded 300 milligrams a day. When he stopped all but one low-dose capsule, the tremors eased within 2 months. "I thought I was fueling my brain," he later said, "but I was flooding it." Vitamin B6 should not be feared but respected. For most older adults, 2 to 10 milligrams daily from food found naturally in salmon, chicken, potatoes, bananas, and avocados is more than enough. Supplements can be helpful when prescribed, but excessive doses offer no advantage and may invite trouble. The message is simple: the nervous system thrives on rhythm, not overload. Before continuing any high-dose supplement, consultation with a healthcare provider is essential. Ask to measure B6 and homocysteine levels, and consider balancing B6 intake with B12 and folate from leafy greens and eggs. Protecting the brain and nerves after 60 is less about adding more and more about understanding what enough truly means. When chemistry, diet, and awareness move in harmony, clarity and steadiness follow the quiet rewards of wise living. Number 4, vitamin B12. Nearly 20% of adults over 60 inches in the United States are diagnosed with a vitamin B12 deficiency each year, according to the Centers for Disease Control and Prevention. Because of that statistic, B12 has become one of the most commonly prescribed injections and over-the-counter supplements for older Americans. It is often called the energy vitamin, believed to boost memory, focus, and vitality. Yet recent evidence reveals a troubling twist. When taken in the wrong form or at unnecessarily high doses, vitamin B12 can quietly disrupt the brain's delicate blood chemistry and raise the risk of stroke. Vitamin B12 is vital for nerve repair, red blood cell formation, and DNA synthesis. The body uses 2 natural forms, methylcobalamin and adenosylcobalamin. But the version most widely sold, cyanocobalamin, is a synthetic compound created for stability and low cost. To make it usable, the liver must strip away its cyanide component and convert it into active B12. For healthy young adults, that process is usually effortless. For older adults, whose kidneys and liver often work more slowly, the conversion can become incomplete, leaving behind toxic byproducts that irritate blood vessels and thicken the blood. A 2020 study in the journal Stroke found that seniors with very high serum B12 levels, often those receiving frequent cyanocobalamin injections, were 3.5 times more likely to experience ischemic stroke compared with those who maintained moderate, balanced levels. When paired with high folic acid intake, the risk increased even further. Researchers believe this combination can elevate homocysteine, a compound that makes blood more viscous and damages the inner lining of arteries. In simple language, it turns smooth, flexible vessels into sticky pipes where clots can easily form. These numbers are not just statistics. In a small neurology clinic in Chicago, a retired engineer came for evaluation after brief episodes of confusion and vision changes. His tests were largely normal except for one detail. His vitamin B12 level was 5 times the upper limit of normal, the result of monthly cyanocobalamin injections he had taken for energy. After switching to a modest dose of methylcobalamin twice a week and improving hydration, his symptoms disappeared within weeks. The brain, once overburdened, began to find its balance again. This does not mean B12 should be avoided. In fact, true deficiency can cause anemia, depression, and irreversible nerve damage. What matters is using the right form and the right dose. For maintenance, 250 to 500 micrograms of methylcobalamin 2 or 3 times a week is often enough for healthy seniors, though each person's needs differ. The key is to confirm deficiency with a blood test before supplementing heavily, rather than assuming more is better. Before continuing injections or high-dose pills, consultation with a physician is essential. Ask to check both B12 and homocysteine levels. Discuss switching to methylcobalamin or adenosocobalamin if already on cyanocobalamin, and never combine large doses of folic acid and B12 without guidance. The lesson of vitamin B12 is a reminder that energy cannot be manufactured by force. The aging brain thrives not on excess, but on equilibrium. When nutrition, medical advice, and self-awareness move together, vitality returns naturally, quietly, steadily, and safely. Number 5. Ginkgo biloba. What if the very herb trusted to sharpen memory could, in certain cases, put that same memory at risk? Across the United States, bottles of Ginkgo biloba line pharmacy shelves, promising clearer thinking and youthful focus. For decades, this ancient extract from the leaves of the ginkgo tree has been a symbol of hope for aging minds. Yet beneath its reputation as a natural brain booster lies a delicate truth. In the wrong circumstances, ginkgo can quietly increase the risk of bleeding in the brain. Ginkgo's power comes from its natural compounds, flavone, glycosides, and terpene lactones that help dilate blood vessels and improve circulation. In moderate amounts and standardized extracts, it can indeed enhance oxygen delivery to the brain. The problem appears when the dose is too high, the product poorly regulated, or when it is combined with medications that already thin the blood. For many older adults who take aspirin, warfarin, or even over-the-counter pain relievers like ibuprofen, adding ginkgo can tilt the balance toward danger. A 2018 study in neurology followed adults over 60 and found that those using high-dose ginkgo supplements had a 38% higher risk of hemorrhagic stroke. Another report in the Journal of Geriatric Pharmacotherapy described seniors who developed spontaneous brain bleeds after taking ginkgo along with daily aspirin. Scientists explained that the herb's active molecules prevent platelets from clumping, similar to blood thinners, which can turn a small vessel leak into a serious hemorrhage. Imagine the brain's vessels as a vast network of fragile threads. As we age, those threads grow thinner, more brittle. A modest dose of ginkgo may help those threads stay flexible. Too much, however, can make them snap. The first warning signs, sudden dizziness, slurred speech, or unexplained bruising should never be ignored. Many mistake these symptoms for fatigue or normal aging, yet they can be signals that the brain's tiny vessels are under strain. In one quiet suburb of Seattle, an 82-year-old retired violinist began taking 2 ginkgo capsules daily to improve her memory and coordination. She also used a baby aspirin each morning on her doctor's advice. After several weeks, she noticed ringing in her ears and brief spells of confusion. A scan later revealed a small brain hemorrhage. Her physicians advised stopping the herb and adjusting her medication. Months later, her balance and focus returned, and she now tells her friends, even good things need good guidance. That wisdom is the heart of this story. Ginkgo biloba is not inherently harmful, but like any medicine, it requires knowledge and restraint. Before using it, check the label for a standardized extract 24% flavone glycosides and 6% terpene lactones, and consult a healthcare provider. especially if already taking blood thinning or blood pressure medication. The goal of brain health after 60 is not to chase miracles, but to maintain harmony. True mental clarity comes from balanced circulation, steady breathing, restful sleep, and daily movement, not from a handful of pills. The brain does not need to be pushed harder. It needs to be cared for more wisely. Nature offers many gifts, but their strength lies not in quantity, rather in the understanding of when enough is enough. Number 6, vitamin D and calcium. On a quiet street in San Diego lived two neighbors, both in their late 60s, both determined to stay strong and independent. Margaret, a retired teacher, loved the warmth of the morning sun. Each day she slipped on her walking shoes and strolled through the park, greeting the same joggers and stopping to smell the jasmine. Across the street, Helen, a former accountant, preferred precision over spontaneity. Her day began at the kitchen table, where she carefully arranged her supplements: 2 calcium tablets, 1 large vitamin D capsule, and a multivitamin just to be safe. They shared the same goal: healthy bones, a clear mind, a body that would carry them gracefully through old age. Yet within a year, their stories unfolded very differently. Margaret's doctor told her that her bone density was stable, her heart rhythm strong, her step light. Helen, however, began to feel unusually tired. She complained of headaches and a heaviness in her chest that came and went. When her doctor ordered blood tests, the results were surprising. Her calcium level was high, her vitamin D well above the recommended range, and her arteries were beginning to stiffen. The nutrients meant to protect her were slowly burdening her heart and brain. For decades, Americans have been told that vitamin D and calcium are the ultimate duo for bone health. The message seemed simple: take more, stay strong. But the truth is subtler. Vitamin D helps absorb calcium, yet when taken in excessive amounts, especially alongside high-dose calcium supplements, the body cannot use it all. What remains may settle where it does not belong: along artery walls, in the kidneys, even in the tiny vessels that feed the brain. Over time, this buildup can reduce blood flow, raising the risk of stroke or heart disease. Scientific evidence supports this caution. A study from the Journal of the American Heart Association found that adults who regularly used calcium supplements had a 22% higher risk of developing artery calcification compared with those who obtained calcium through food. Researchers at Johns Hopkins University also reported that long-term high-dose vitamin D can lead to elevated calcium levels, damaging blood vessels and impairing circulation to the brain. Margaret's daily walk, by contrast, gave her body a natural balance. The gentle sunlight stimulated her own vitamin D production, about 800 to 1,000 international units, after a short morning stroll without overwhelming her system. Her calcium came gradually from milk, leafy greens, and almonds, released into the bloodstream in perfect harmony with her body's needs. Helen's experience became a lesson she now shares with friends. I thought I was protecting myself, but I forgot that nature already gave me what I needed. IBP said, for most older adults, a simple blood test can determine whether vitamin D or calcium supplements are truly necessary. Many need far less than they think. Discussing dosage and timing with a physician ensures the body receives support, not strain. True strength in later life rarely comes from excess. It grows from rhythm, balance, and mindful living. The story of Margaret and Helen reminds that health is a conversation between the body and nature. One found her medicine in sunlight, motion, and moderation. The other discovered that even good intentions require guidance. The wiser path, as both women now agree, is not to fight the body's wisdom, but to listen to it. Number 7, vitamin K. The human bloodstream can be compared to a finely tuned orchestra. Every instrument, platelets, clotting factors, and vessel walls must perform in balance. Vitamin K acts as the quiet conductor, guiding the rhythm of clotting so that a simple bruise stops bleeding and a healing wound closes in time. But just as an orchestra can be thrown off by one instrument playing too loudly, too much or too little vitamin K can disrupt the entire performance, especially in older adults who take blood-thinning medications. For years, vitamin K has lived in the background of health conversations, often overshadowed by flashier nutrients like vitamin D or omega-3 seconds. Yet its influence is profound. Without enough of it, the body struggles to form clots, leading to easy bruising, nosebleeds, or dangerous internal bleeding. Too much, however, especially in supplement form, can interfere with anticoagulant drugs such as warfarin. That interference can swing the balance the other way, causing blood to clot too readily and increasing the risk of stroke. The American Heart Association notes that approximately 2.4 million older adults in the United States use anticoagulant therapy. For them, even modest changes in vitamin K intake can alter the drug's effectiveness. Warfarin works by blocking vitamin K's ability to activate clotting proteins. When someone suddenly increases their vitamin K through supplements or high K foods like kale, spinach, or broccoli, the medication may lose its potency. The result can be a silent buildup of clots inside blood vessels, sometimes leading to stroke or heart attack. In a small community hospital in Ohio, a patient named Robert, age 74, learned this lesson unexpectedly. After watching a television segment praising vitamin K for longevity, he began taking an extra 200 micrograms daily in capsule form, believing it would strengthen his bones. Within weeks, his blood-thinning medication stopped working as intended. A mild stroke followed, leaving him temporarily weak on one side. Once his doctor adjusted his diet and medication, his strength returned, but so did his respect for the fragile balance inside his body. Vitamin K is not an enemy. In fact, it is vital for bone density, arterial elasticity, and brain protection when consumed naturally through foods. Green vegetables, fermented soy products, and certain cheeses provide just the right amount. The key is consistency. Doctors often say, it's not how much vitamin K you eat, it's how steady you are about it. Eating similar portions each week keeps blood-thinning medications stable and the body's internal rhythm in tune. Before starting or stopping any supplement, especially vitamin K, consultation with a healthcare provider is essential. A simple blood test called the INR can measure how well blood is clotting and whether adjustments are needed. Supplements may still have a place for some people, but only under medical supervision. The comparison to an orchestra holds true until the end. When every part of the system follows the right tempo, diet, medication, and lifestyle, the result is harmony. The melody of good health depends not on volume, but on precision. Not on adding more notes, but on knowing when to pause. Number 8, folic acid, vitamin B9. Few people realize that a simple vitamin meant to protect the heart and brain can, in the wrong circumstances, quietly make both more vulnerable. It sounds unbelievable, yet studies show that excessive folic acid, especially when combined with high doses of vitamin B12, may increase the risk of nerve damage and even stroke in older adults. What was once celebrated as the brain-protecting vitamin can, without careful balance, become a silent saboteur. Folic acid, also known as vitamin B9, plays an essential role in forming new cells and lowering homocysteine, an amino acid linked to heart disease and cognitive decline. Because of these benefits, food manufacturers began fortifying bread, cereals, and flour with folic acid in the late 1990s to prevent birth defects and improve public health. It was one of the most successful nutritional policies in history. But for older adults, especially those over 60, the same fortification combined with daily supplements can push total intake far beyond the body's needs. Unlike folate from natural foods, synthetic folic acid must be converted by the liver before it can be used. With age, that conversion slows, leaving unmetabolized folic acid circulating in the bloodstream. Researchers at Tufts University found that seniors with very high folic acid levels and low vitamin B12 were more likely to experience cognitive decline and nerve damage. A separate study in stroke reported that while moderate folate intake supports vascular health, excessive synthetic folic acid can paradoxically raise homocysteine in some individuals, undermining the very function it was meant to improve. It's as if a repair crew sent to fix a bridge began blocking the traffic instead. A retired school principal named Evelyn learned this lesson in her own kitchen. At 72, she prided herself on eating fortified cereal each morning and taking a heart and brain health supplement containing 800 micrograms of folic acid. When she began noticing tingling in her feet and brief moments of confusion, she assumed it was aging. Her neurologist found her folate level was triple the upper limit, while her B12 was low. After adjusting her supplements, switching to leafy greens for natural folate, and adding methylcobalamin for B12. Her symptoms gradually disappeared. I thought vitamins couldn't hurt, she said later, but it turns out even good things need guidance. The human body values equilibrium above all else. Folate from spinach, avocados, lentils, and citrus fruit enters the bloodstream gently, allowing the body to convert only what it needs. Folic acid from pills and fortified foods floods the system at once, asking aging organs to do too much. The solution is not to abandon B9, but to approach it wisely. For most adults, 400 micrograms of folate from food or methylfolate supplements is sufficient, but needs vary, especially for those already on vitamin B12 therapy. Before adding or continuing high-dose folic acid, consultation with a physician is essential. Blood tests can identify whether levels of B9 and B12 are in balance. The lesson of folic acid is a humbling one. More nutrients do not always mean more health. The brain, like the heart, flourishes in moderation. When vitamins are guided by understanding rather than fear, they fulfill their true purpose to nourish, not to overwhelm. In the end, all 8 stories share one simple truth. The human body is a masterpiece of balance, not abundance. Every cell, vessel, and nerve operates with quiet precision, asking only for what it needs, no more, no less. Yet, in a culture that often celebrates more is better, even the most well-meaning habits can drift toward danger. The same vitamins that promise health and longevity, E, A, B6, B12, D, K, folic acid, and even herbal boosters like ginkgo can become harmful when taken blindly in synthetic forms or at doses far beyond what the body can manage. Across the stories, there are lessons worth remembering. The retired teacher Margaret found her strength not in bottles, but in sunlight and daily walks. Helen learned that too many tablets could harden the very arteries she hoped to protect. Robert in Ohio discovered that adding just one more vitamin K capsule could undo years of careful treatment. Evelyn realized that excess folic acid, once praised as a brain protector, could cloud the very clarity she wished to preserve. And the artist from Santa Fe, the librarian from Oregon, the violinist in Seattle all found the same wisdom, that nature already gives the body what it needs when treated with patience and respect. Science supports what common sense has long known. Studies from the British Medical Journal, Harvard, Johns Hopkins, and the American Heart Association all echo the same message. Moderation matters. Too much synthetic vitamin E can thin the blood dangerously. Excessive vitamin A can strain the liver and raise pressure in the brain. High-dose B6 and B12 can alter nerve and vascular chemistry. Overloaded calcium and vitamin D can harden arteries. Sudden changes in vitamin K can disrupt blood thinners. And fortified folic acid, though beneficial in small amounts, can burden older organs when unchecked. The pattern is clear balance, not excess, sustains life. The real miracle of aging lies not in chasing youth, but in understanding rhythm. The body does not need more pills. It needs wiser habits. A plate of colorful vegetables gives safer vitamin A than any capsule. 10 minutes of sunshine creates vitamin D more efficiently than any supplement. A handful of nuts or spinach offers vitamin E in its natural harmony. Walking, sleeping well, laughing often, these are the forgotten multivitamins of longevity. What keeps the brain young and the heart strong is not found in the quantity of nutrients, but in the quality of choices. Before adding or increasing any supplement, consult a doctor. Ask questions. Check your labels. Know what you are taking and why. Let knowledge, not fear, not marketing, guide your decisions. If today's stories resonated, take a moment to reflect on your own routine. Which habits truly serve your health, and which might be quietly working against it? Share your thoughts below, because your experience could help someone else stay safe. And if you haven't subscribed yet, join this growing community by clicking subscribe now. Stay with us for more science-based stories, simple health lessons, and real-life inspiration to help you live strong, sharp, and joyful at every age. Thank you for watching. May your days ahead be filled with balance, light, and the quiet confidence that you are treating your body with the wisdom it deserves. Have a wonderful day, and remember, the best medicine is moderation, guided by understanding and love.